6 warning signs of colon cancer. As the sun rose over Seattle, Sarah Miller, a vibrant 35-year-old mother of 2, found herself doubled over in pain for the 3rd time that week. "I never imagined that my occasional stomach aches could be something so serious," she later recounted, her voice trembling. Sarah's story is not unique. In fact, the American Cancer Society estimates that in 2024, over 151,000 Americans will be diagnosed with colorectal cancer, with nearly 53,000 deaths expected. But what if we could change these statistics? What if we could learn to recognize the warning signs before it's too late? Dr. Emily Chen, a leading oncologist at the University of Washington Medical Center, often tells her patients, "Colon cancer is like a stealthy intruder. It doesn't always knock loudly. Sometimes it whispers." These whispers, or early warning signs, are what we're here to explore today. Sarah's journey began with what she thought was just an upset stomach. "I blamed it on my love for spicy food," she chuckled softly. But as weeks turned into months, the discomfort persisted, joined by unexplained weight loss and fatigue. Little did Sarah know, her body was trying to tell her something crucial. The first warning sign Sarah experienced was a change in her bowel habits. She noticed her stools becoming narrower, almost pencil-thin at times. This change, while subtle, can be a red flag for colon cancer. The growing tumor can cause a narrowing of the intestinal passage, affecting the shape of waste as it passes through. Next came the blood. At first, it was just a few drops on the toilet paper, easily dismissed as hemorrhoids. But as time went on, the bleeding became more frequent. This is the second and perhaps most alarming warning sign of colon cancer. Any rectal bleeding, no matter how small, should be taken seriously and promptly discussed with a healthcare provider. Sarah also experienced persistent abdominal discomfort, our third warning sign. She described it as a dull ache that would come and go, often accompanied by bloating and gas. While these symptoms can be attributed to various digestive issues, their persistence is cause for concern. The fourth warning sign snuck up on Sarah gradually: unexplained weight loss. Despite maintaining her usual diet, she found herself losing pounds without trying. This seemingly positive change can actually be a sign that something is amiss in the body. Fatigue, our fifth warning sign, became Sarah's constant companion. "I thought it was just the stress of being a working mom," she reflected. But this bone-deep exhaustion was more than just everyday tiredness. It was her body's way of signaling that something was seriously wrong. The final warning sign in Sarah's case was anemia. During a routine checkup, her doctor noticed her pale complexion and ordered a blood test. The results showed low iron levels, often a result of the slow, chronic blood loss associated with colon cancer. Sarah's story serves as a powerful reminder of the importance of listening to our bodies and seeking medical attention when something doesn't feel right. After a colonoscopy confirmed her diagnosis, Sarah underwent surgery and chemotherapy. Today, she's cancer-free and passionate about sharing her experience to help others. But Sarah's story isn't just about recognizing symptoms, it's about prevention too. Regular screenings, starting at age 45 for average-risk individuals, can detect polyps before they become cancerous. A healthy diet rich in fruits, vegetables, and whole grains, combined with regular exercise, can also reduce your risk. As we conclude Sarah's story, remember, knowledge is power. By understanding these 6 warning signs, changes in bowel habits, rectal bleeding, abdominal discomfort, unexplained weight loss, fatigue, and anemia, we arm ourselves with the tools to detect colon cancer early, when it's most treatable. Don't let colon cancer whisper in the dark. Listen to your body, know the signs, and speak up. Your life, like Sarah's, may depend on it.